Hi, everybody. Welcome to HLAA North Bay of California March meeting. We're located north of San Francisco in Marin and Sonoma counties. I'm Sarah Ozer. I'm the president. Jim Ozer, my husband, is here. He's a tech host. This meeting's being recorded. Alan Katsura from the Diablo Valley chapter will be editing and uploading the meeting to YouTube. Being together at this meeting is a way of supporting our cause to better the lives of people with hearing loss. If you'd like, please put the city, state, or LA chapter you're from in the chat so that we can get to know each other better. The mission of our chapter is to improve the world of communication for people with hearing loss through information, education, support, and advocacy. Today we have a presentation with Nicole Weston. After that, we'll have a Q&A. I'll have a few announcements, and then you may leave or stay after to socialize. I have a special announcement about the upcoming Walk for Hearing. So, Walk for Hearing is taking place on Saturday, June 4th at Crown Beach in Alameda. That's across the bay from us. The purpose of the walk is to raise awareness about hearing loss. There are walks throughout the country at different times in the spring, summer, and fall. In Alameda in June, there will be walkers from all over California, including Marin and Sonoma, Oakland, Alameda, San Francisco, Palo Alto, and beyond. We are the North Bay team, and I am your team captain. We'd like for you to sign up to walk in person with us on June 4th. Your friends, neighbors, family are welcome to walk with us also. They need to sign up. It's also an opportunity for us to raise money for HLAA. And you may invite your friends to donate also. I want to show you a really cool shirt. This is from last year, 2021 virtual HLAA Bay Area Walk for Hearing. And you can see there are names on the back. These names on the back are sponsors. So if you would like to be a sponsor and donate more money than $5 or $10, and it's all set up in the website, then you can get your name here also. Can get a personal name or your organization right here. So in any event, we hope you'll join us and you'll sign up. You can sign up at walkforhearing.org or go to our website and get further information. So we look forward to seeing you then. So on to our presenter, Nicole Weston. I'm going to get a drink of water. What is a cochlear implant? I've got one. How does it work? How do you get a cochlear implant? What is the process? How do you know if you're eligible for a cochlear implant? How does the insurance work for cochlear implants? What is the American Cochlear Implant Alliance doing to let hearing health professionals, patients, and the world at large know about cochlear implants? Welcome, Nicole Weston. Your title, Government Policy Manager at ACI. And I will leave the presentation to Nicole now. After Nicole speaks, we will have Q&A. Please put your questions in the chat, and then I will go through the chat questions and give them to her. That way she can speak uninterrupted. After the presentation, We'll have a few announcements after the Q&A. And then if you'd like to stay on to socialize, that would be great. So, Nicole, thank you for being here. If everyone could mute, that would be helpful.
All right, thank you so much, Sarah. I am very pleased to be here this evening. Like she said, I am with the American Cochlear Implant Alliance, and I've been there about 4 years now. And I've been doing government policy in a wide variety of areas for about 25. I've worked on the Hill, I've worked in the executive branch, I've done a lot of very fun things. So Sarah, if it's okay, could you turn on screen sharing for me, and then I will share my PowerPoint and we can get going. But in the meantime, I do a wide variety of things at the ACI Alliance. Like I said, I do a lot of the government stuff at both the state and the federal level. I manage our advocacy networks, and I help out in a lot of different ways. And we have been very busy this past year with a wide variety of some policy issues and getting ready for our upcoming conference, which is just around the corner. So I'm going to start my slideshow. All right, so just this is what I'm going to go over, which is introducing who we are, what is a cochlear implant, insurance coverage, a couple of our advocacy efforts, some resources, and then of course Q&A. And all right, so sorry, there you go. All right, so first a bit of history. We always like to talk about this because the ACI Alliance is kind of unique in that we do bring together just about everybody who is associated with the continuum of care of cochlear implants. A lot of the other hearing health organizations can be a little bit siloed, we found, which is why they decided to start this new organization in 2010. And our members include audiologists, SLPs, the surgeons, deaf educators, early intervention specialists, AV therapists. We have veterans, military members, adult recipients of CIs, and then the families of children with CIs. So we do have a little bit of everybody. And we do have a lot of international members, as well as, of course, being based in the United States. Our mission is to advance CI access through research, awareness, and advocacy. And in 2012, that was when our board of directors was officially formed. Donna Sorkin came on as the executive director. We began a Medicare study for the expansion of CI, and I'm actually going to touch on that in just a little bit. And we began an organization, took over the organization of the annual CI Clinical Research Conference. Our last two conferences were, of course, virtual. Our 2020 conference was set for the second week of March 2020, so you can all imagine how that went. I still managed to make it to Disney World later on, as the conference was supposed to be in Orlando. Our next one is set to be in May in Washington, D.C., and we will be in person. And honestly, I am ecstatic about the thought of doing an in-person conference. We fully officially began our 2013 public policy advocate activities, which really focused on organizing our state champion program. And our early focus was, of course, on the Affordable Care Act. And then, of course, we looked at, all the other pieces that go into getting an organization off the ground. So this is our 10-year anniversary. So we're doing a couple things that focus on that. And like I said, our mission is to encourage and support research on candidacy and the broad impacts of CI on children, adults, and the improvement of delivery of CI services. Advancing awareness of best practices to a broader audience, primary care doctors and other professionals, early intervention, educators, policymakers, and the general public. And of course, advocacy, which is where I come into play, which is educating and encouraging policymakers and insurance providers to improve CI access. So where are we today? We are unique as an organization because, as I mentioned, we do the full access to the care continuum. We have about 2,000 members right now, and we continue to provide information and conduct research. And we consider ourselves the most successful CI advocacy organization in the world. But we continue to realize that we have a great deal more work to do, and we continue to grow. We now have 4 staff members, which has doubled since I started 4 years ago. And we've been a lot more active on social media as well to help promote that information out there. So what is a cochlear implant? It is a small electronic device that provides auditory information to adults and children with a varying degree of hearing loss. It was first approved by the FDA for use in adults in 1985, and then for use in children in 1990. This was for bilateral hearing loss. The FDA approved one device for single-sided deafness in 2019, and a second device just this past summer. And it consists of an external portion that sits behind the ear, which is of course the processor, and a second portion that is surgically placed under the skin, and then the implanted portion electrically stimulates the inner ear to deliver the sound. And as you look on this photo, you can see the internal device, which is very small, and it has the small loop that goes into the cochlea. And then it has an example of an external device with the magnet, the transmitter, antenna, and then the processor, battery, and the microphone. Of course, sometimes these can look a little bit different based on the manufacturer that you end up using. And for those who do not know, there are 3 manufacturers currently operating in the United States, and that's AB, Med-El, and Cochlear. So how does a CI work? For me, as somebody who has, only been in this world for about 4 years, it still seems like absolute magic to me. And I know when we talk to a lot of the parents, their kids and also some adults call it their bionic ear, and they all think it's fantastic. So basically, the first step is, of course, the sound is picked up by the microphone. The processor filters and codes the signals and sends it to the coil, and the signal is then sent via radio frequencies to the internal device, and the electrodes are activated and stimulate the cochlea, and that coded electrical signal is sent to the hearing nerve, which is then sent to the brain for interpretation. And one thing that, I know I have my audiologist kind of beat into my head when we're in various meetings is the fact that it can take a while sometimes for the brain to interpret what the sounds are. So for some people who may have been hearing for a while and then they lost the hearing, it can be a little bit quicker of a process. For somebody who is newly implanted or has been without sound for a while, it can sometimes take a while for the brain to process what exactly those sounds are. I was talking with a woman who had no idea that, clocks make noises or, those things. And then they were able to, after a while, the brain figured it out. And I think that's just fantastic how the brain is able to do that. Next slide. I put this one in here, which is how a hearing aid works, just to kind of the difference. There are a lot of people who still confuse the two. There are a lot of insurance policies that still confuse the two. With a hearing aid, a sound is picked up by the microphone. It is then amplified and then is sent to the ear via the ear mold. And obviously hearing aids have improved significantly over time. They've gotten smaller. I know my dad, who is 74, continues to lose his all the time. And we continue to help him find them all the time. And they work great for a lot of people. But for some people, as their hearing loss progresses, a CI might be a better option for them in the future. Which then, of course, leads to another all-important question is, what are the steps to getting a cochlear implant if I am somebody who is interested in one? And this is just another great image of what a CI looks like from just a little different angle. and this is up on our website, but I think it's also important to kind of show it here too. The first is if you are interested in getting a cochlear implant, it's of course figuring out whether or not you would qualify for one. And that usually starts with a hearing screening with an audiologist who is especially trained when it comes to cochlear implants. There is a little bit of additional training, so they're a little bit more specialized than a hearing aid technician or something along those lines. Generally, it's a history again of your hearing and hearing loss, the diagnostic evaluation, optimizing the hearing aids. Then it's an aided speech perception evaluation that generally is testing to see what your sentence recognition is, and then grading that on the scale. Sometimes it's done in quiet, sometimes it's done in more of a natural live environment, a real world environment. Sometimes there's counseling involved depending on the CI clinic. And then it goes to a further discussion about whether somebody is a candidate for a CI or whether they would continue with amplification with hearing aids. And of course, a conversation about what those expectations of having the implantation would be. The second step is the pre-op medical assessment. This is generally done by the surgeon in the CI clinic's office. There's the physical exam and additional examinations as indicated. There's a radiological assessment. It's usually an MRI to make sure that the cochlea is intact. So it's something to make sure that it would even work or function, that there's no calcification, anything along those lines. Whether the ENT thinks it's something that can be done. The meningitis immunization and others is generally one that is decided by the hospital system and what the surgeon requires. Some require pneumonia. It depends on the ages of the person who's being implanted. I see some say you should do it, some say you shouldn't. Then there's generally, the additional counseling and discussions with the audiological team that would be taking over for the mapping and the surgeon. And then of course, the review of the surgical procedures and the potential risks. No surgery is without risks, of course, but they are minimal. And then of course, the expectations. And then of course, there is the surgery, which is the implantation of the device. It's generally outpatient. I think that surprises a lot of people. From what I understand, before you might be able to stay overnight. Before COVID hit and everything shut down, I was actually going to go see a surgery take place, which was going to be incredibly interesting. And I was going to, fortify myself for it because I admit to being a little bit squeamish, but I think the whole thing is just really fascinating. And then of course, step number 4 seems rather logical. It's all your post-operative checks prior to initial activation to make sure the scar is healing right, everything is in its place. And then you have the follow-ups there and medical follow-ups as needed. This is very standard for anybody who's had any kind of operation or hospital stay. And then after that, you have your initial activation when they activate the device and get that started and start setting your maps. Generally that's 2 to 4 weeks post-surgery. Some can be extended a little bit, can be delayed a little bit. Sometimes they've been a little bit early. I think the earliest I've heard though is 2 weeks, just to make sure that swelling has gone down and things along those lines. And then there is more follow-ups, especially that first year. And this is generally when they are tweaking the processor with the computer and doing what they call a mapping, which is to make sure that the sound is optimized. And as your brain relearns or learns for the first time what these sounds are, your mapping will change. And different devices have a different number of maps that can be used for different sound settings. And for more information on that, I would always recommend talking to a trained professional who's an audiologist who does these. I've sat in a couple of mapping sessions, and it's really incredible to see just how much they can fine tune these devices. It's really fantastic. They do recommend an annual follow-up every year for appointments just to tweak the mapping a little bit. And sometimes that's been a little bit delayed, especially with COVID recently. And then the final step is just sort of rehab and device maintenance. When we talk about rehab, it could be speech therapy, it could be auditory therapy, where you see a therapist who can help you relearn how to hear and how to speak. And that for adults, that can vary. A lot of adults seem to prefer to do it on their own, whether it's listening to music, listening to audiobooks, listening to podcasts, putting on the closed captioning and following along with the sound. There's a couple apps that you can do. I was interviewing a recently implanted gentleman who's implanted, I think he's in his 50s, he said, and he had a hearing aid that barely worked for most of his life. And he said the absolute best auditory therapy that he could ever think of, and he recommends to everybody, is just to pick up an instrument and start playing it, because as you're learning to tune the instrument, you're learning to really get the brain working. And I thought that was some really interesting advice. Of course, there's replacements and upgrades of the processor. I think a lot of people are surprised to find that you very rarely have to replace the device inside. Donna Sorkin, who I mentioned before, is the executive director of the American Cochlear Implant Alliance. She's had her device since the 1990s, and all they do is keep upgrading the processor. Most insurances will cover a replacement processor after 5 years. Some do, some don't. I will say that we sometimes do spend a lot of time working with insurances to make sure that they provide the appropriate coverage for the processor. And then, of course, there's the peripherals such as batteries and things along those lines, and the coils and all of those other fun things that come in the beautiful backpacks that I've seen that you get when you get a new processor. Batteries are covered by most Medicaid programs. They are covered by Medicare, and they're often covered by some private insurances. One thing that we do recommend is to always read the fine print with your insurance. And also, if you are changing to additional insurance policies, to really read the fine print and find out exactly what is covered. I think a lot of people are taken surprise sometime, and I apologize. I will slow down. I apologize for that. So this is our organizational members, a map of them. Our organizational members are CI clinics, which is where people can go to be evaluated and to have the surgery. We do have a number of them in the state of California. I do want to mention that if there is a state that isn't filled in yellow, there are clinics that are there. They just don't happen to be ACI Alliance organizational members. But there are a number of them on there. And if you go to our website to look at this map, you can, of course, click on California and it will provide the list there. And those are generally people who follow some of the best practices along those lines and attend a lot of the training and things like that we provide. So insurance coverage for CI is, of course, an incredible important thing, because a lot of people want to know how much it's going to cost, especially in light of the fact that hearing aids are not covered by most insurance policies. So most private insurance companies cover the continuum of care for CI. As I did mention a little bit earlier, that can vary. And so we do highly recommend that people read the fine print and ask those questions, especially if they are transferring to a different insurance policy. I've heard stories of people who have had really great coverage with one, started a new job. The new insurance doesn't cover CI at all. So processor replacements or something along those lines. If that's the case, that does happen. We do have ways to remedy that. And we are always more than willing to work with people along those lines. Medicare does cover for those who are 65 and older. It covers, like we mentioned, the device and the follow-up and parts and replacements. Medicaid, since it is a state-run program, it does cover it in 60% of states, covers the surgery for adults. Medicaid is required to cover CI coverage for all children up to the age of 21. It is for adults where it does vary. This is an issue that we do have tackled on the policy side. We've worked, for instance, in Maryland to change those laws to cover adults. We are working in additional states as well. Washington State is an example of one that we're focused on, and as well as I think Alabama. I do believe California does cover, Medicaid does cover in the state of California for cochlear implants. And part of the reason why this is important, it's not just for late deafened adults who might be interested in getting a CI, it's also for those people who are on Medicaid as children and then need to stay on Medicaid after the age of 21. If the state doesn't cover it, they lose coverage of their processors, replacements, rehab, and the like. So they're just immediately cut off, and that is a huge deal, because if they lose it, it means it can't be replaced. If they run out of batteries, they may not be able to replace them, and so they may suddenly go without sound. TRICARE and the VA also do provide coverage as well, but the VA is, of course, service related loss. So you have to have had your loss related to your military service to be covered by the Department of Veterans Affairs. So single-sided deafness, I believe I mentioned earlier that it is only recently that the FDA had approved some devices for single-sided deafness. Of course, there were people who were being implanted for SSD before that was approved for, medical necessity and the like. Medicare, however, does not cover implantation for unilateral loss. It is only for single-sided deafness. Medicaid has done it for children on a case-by-case or a state-by-state basis. We actually worked with a mother in West Virginia a couple years ago to overturn a Medicaid decision for her child. And private insurance varies. And what we have found to be really interesting with COVID is that there has been, we've seen an increase in cases being denied, but we've been working on solutions. And what we have also thought is very interesting is that some of the larger CI clinics that are very good at working with insurance policies, who initially deny, are still continuing to be denied for single-sided deafness after all of the multiple requests for looking at it again, whether it's peer-to-peer review or something along those lines. We do have some white papers that we have up on our website and that are forthcoming about why implanting for single-sided deafness is important for both children and adults. And we are also hoping to do some further research on this and provide a paper on this in the future. So we are certainly aware that there are some issues when it comes to insurance coverage for single-sided deafness. But it's one that often your clinic can help find a solution for. And if not, we are more than willing to work with people to move the needle on that. So I'm just going to briefly touch on something for the national coverage decision when it comes to Medicare. This is something that is just coming to fruition this month. This is work that began over 10 years ago, which was a study sponsored by CMS with the ACI Alliance, which was to look at of where Medicare currently covers for, considers when a person qualifies for a CI under Medicare, which is currently, I believe, at 40% recognition of sentences. And it would be expanding that coverage to 60% sentence recognition, which is a good expansion because it would cover a lot more people. People generally do better if they are able to obtain a CI before their hearing fully diminishes. And the goal is to get Medicare closer to what the FDA guidelines are for candidacy. As many people and private insurance companies do look to Medicare for what they're doing in general, if we are able to change that with Medicare, it will very likely equalize care between all of the various insurance payers. Now, a lot of them do follow what we call the 60-60 guidelines, and we have those up on our website as well. But Medicare, like I said, is an outlier, and our goal is to change that. And we are hoping we can move the needle on that by the end of this year. It's been a very long process. So I'm going to briefly talk a little bit about kind of what I do and our advocacy networks, which have been really critical in talking about, the Medicare decision that I mentioned earlier, focused on changing Medicaid state laws and changing some of the rules when it comes to single-sided deafness, as well as a couple other things I'll talk about in just a minute. The State Champions program is the one that was founded the same year as the ACI Alliance. These state champions come from across the continuum of care. We have surgeons, we have SLPs, we have audiologists, we have adult recipients, we have parents, we have deaf educators, we have some early intervention specialists, we have people who run EDI programs. We have them in almost every state, and I think we've got a total of 170 at this point. And they are incredibly important to the policy work that we do. They not only provide us with background on state and national issues, which are impacting CI, they're generally the ones who are kind of our canaries in the coal mines. They're the ones who will call us up and say, we are seeing some issues when it comes to single-sided deafness. We have a state champion who called us and said, I can't get coverage for adults under Medicaid in my state. Can you please help us? So a lot of our work is driven by what they want us to do. Another one that we have been focused on, and a bill just passed in Florida, which is CMV, which is a virus that is is the #1 non-genetic cause for hearing loss in the United States. 1 in 200 babies are born with CMV. However, it is not a part of any of the testing that is done as part of the newborn screening process. And we are working on that state by state, because if you're able to have, if an infant fails the newborn hearing screening process, if we are able to test them for CMV immediately afterwards, it's much easier to keep track of that child and to make sure that they have follow-up hearing screenings further on. So it's an issue they brought to us, and it's one that we are really proud to be a part of. Our newest one is called CI CAN, which is a clever way of cochlear implant consumer advocacy network. It is, we launched that in 2020, and it's to enhance and enlarge our efforts with firsthand knowledge of CI recipients and families. Like I said, I've been doing policy work and some lobbying work for 25 years now. And always it's the personal stories that make the difference in positively impacting decision makers. If we go and visit with a member of the California legislature or any state, or we go up to the Hill in Washington, D.C., and we meet with somebody, you can have a surgeon telling somebody how great a CI is. You can have an SLP telling somebody how great a CI is. But if you have a parent of a child who is, graduating and has, had done incredible things, and they say it's due to a CI, that's great. We have had, grandparents who've talked about how a CI has meant that they're able to hear their grandchildren and how great that is. So it's those personal stories that really make the difference. And so we've been really pleased with how many people have joined the CI CAN. It's open to anybody. You don't necessarily have to be a member of ACI Alliance, although that's always lovely. And it's just been a really great way to work with them and to kind of move forward some efforts. A lot of them have been active in CMV screening and legislation. We actually had a mom in Connecticut who was denied insurance multiple times for single-sided deafness for her CMV baby. And she was so frustrated with the process that in the end, we were able to work with her to introduce legislation in her state that would mandate coverage for cochlear implants in her state. Nothing has moved forward on the bill, but we're hopeful that we'll be able to introduce that next year and continue that effort. So I'm just going to touch on, I think, 3 of the policy issues that we have been working on recently. The first one is the EDI reauthorization, and that is the Early Hearing Detection and Intervention Program. It covers the newborn hearing screening program, and it also provides early intervention services for children with hearing loss. Since its inception, which I believe was in 2000, newborn hearing screening has resulted in 98% of infants being screened for hearing loss before they're 1 month old. That number before EDI was introduced was at 46%. And before then, it was most children would be caught generally around 3 or 4 or 2, so a little bit older. And, it could sometimes result in a lot of delays moving forward. But with EDI, if, you were able to immediately be enrolled in early intervention services for whatever type is needed for whatever type of hearing loss you have. So what we think is great is the EDI reauthorization actually passed the House of Representatives in December 2021. It was passed unanimously, if you can believe that. It was part of a large package of bills that they were intent on ensuring passed in a bipartisan manner, and the focus has shifted to the Senate. We at the ACI Alliance, actually along with HLAA and a couple other hearing health organizations, as well as the American Academy of Pediatrics, sent a letter recently to the Senate Help Committee and ensuring them of our strong support of EDI. And we have bipartisan support already for that legislation. And we hope to have hearings on that maybe in the late spring or at least the early fall. We do think there is strong support as well on the Senate side. And it would be fantastic if we are able to get that bill passed before the end of the year. Sorry, it seems to have gotten stuck. Hold on. All right, there we go. ALLIES Act. This is a bill that has been introduced in both the House and the Senate, and it would require private insurance plans to cover CI and osseo-integrated implanted devices, as well as the follow-up care. The ACI Alliance has been an early supporter of this bill and also encouraged the original legislation to expand to cover CI and adults and not just children. What we have found with this bill is that it's a fantastic opportunity to encourage support of CI on the Hill and to develop relationships with key members, as I'm sure will not be a shock to you. When we do go to the Hill or we do talk to people, a lot of people have no idea what a CI is. And so this is an excellent opportunity to talk about the importance of insurance coverage and exactly what the device is. So our advocacy networks have been working on growing sponsors for the bill. And we have a lot of parent champions who have been up on the Hill sharing this bill with a lot of other people as well. And the bill is actually named after a little girl in Colorado who has an osseo-integrated device. She has malformed ears and insurance wouldn't cover them. And her mom, with the righteous anger as only a mother can have, decided that that needed to change. And so she worked with her local congressman and they came up with this bill and they're moving it forward. And it's fantastic. It's something that we absolutely certainly support. So access for veterans is another issue that we have worked on for a while. I did mention that the VA does cover it. However, many veterans are completely unaware that not only will they cover hearing aids, a lot of people do recognize that part, but many are unaware that the VA will also cover the CI surgery. So we've been working with the VA on figuring out ways to get that information out there. Just a couple of years ago, they actually had nothing on their website about CI or the fact that they cover them, but that has changed. We've also been partnering with veteran service organizations such as Wounded Warriors and the like to share information and resources. So they have information about us and we have information about them. And what was actually a really excellent project for myself was we collected stories from veterans about their CI experience, and we put them up on our website. I think we have 10 up there right now. And we have stories ranging from Vietnam to the Iraq-Afghanistan war. It was so great for me talking to the veterans about all of them. And we have men, we have women, and it's been eye-opening. I'm convinced a couple of them knew my dad. Both my parents served in Vietnam and my husband is a Marine. So this project was near and dear to my heart. And it's one that we certainly do hope to collect more stories. And we have heard from people who've been able to visit our website and learn more about the process and have moved forward with it. So this is the final thing I wanted to touch on real quick. And this is a new consumer focused series that we started in January. We have labeled it Tuesday Talks, and it's a webinar for CI recipients and parents and families and others. We had one on, the first one was about a parent advocate and how advocacy is important as a parent. Our second one was on understanding your mapping for your child, which was really well attended. We have our third session coming up next Tuesday, and we will be doing a second series very likely later on this year because it has been incredibly well received with a couple hundred people attending. Our CI CAN members have been moderating each session. One of the parents who moderated last week, her daughter is the voice for the Apple Plus cartoon show called El Defo, which is about a little bunny who has hearing loss. And that's a great story about her child as well. And this entire series will be posted online after the series ends. We have a live captioner who is available to talk as who's doing the captioning as well. And like I said, our next one is on March 15th, and that is going to be talking with the writer and producer of the upcoming movie called Rally Caps. It's a baseball movie, which is always fantastic. I'm a huge baseball fan. And it's about a boy who goes to summer camp and has a CI and plays baseball. And we're really excited about that. It should be a fantastic little movie when it comes out. I know that they are looking to set up some sessions with at various baseball stadiums across the country. And now that will actually happen, since I understand there is now that there is a decision with the baseball union, then there will be baseball this year. So if you are interested in that, we would love to have you register and join us for that. So, and then these are just some of our available website resources. If you are interested in checking them out at acialliance.org, we have much more information on insurance. We have additional stories from parents and adult recipients and veterans. We have a blog about adult rehabilitation, and then we have some more details on what is a cochlear implant and steps to a cochlear implant. So that is all I have. So if there are any questions, I'm happy to answer them.
So thank you so much, Nicole. If you have questions, you can put them in the chat, or you can raise your hand. We're a small group, virtually or right here in your Zoom window. I see there is a question from Virginia. Is the CMV that we are seeing in the transcript designating cytomegalovirus?
Yes, CMV. Sorry, I apologize if it caught it as CMB, but yes, it's CMV as in Victor.
V as in Victor.
Mm-hmm.
Oh, okay. And is that correct, what that virus is?
Yes, it's a very long word that I butcher every time I try to pronounce it. So I tend to go with CMV.
Okay.
Mm-hmm.
Other questions?
Yeah, how do I raise my hand on here?
Yeah, Neil.
Yeah, I'm totally on board with all this. advocacy, especially in the political sphere and legislative arena. But are you doing any work, is the Alliance doing any work with the manufacturers on their marketing efforts in promoting CIs, and specifically?
Neil, we can't see your mouth.
I'm sorry. There we go.
Yes, better. Can you start over?
Sure. I'm asking whether or not the Alliance is doing any work with the manufacturers on the quality of their marketing literature to consumers. A common complaint is that the literature, actually an MFT I met with some years ago, put it very distinctly. She said, it's all full of rainbows and butterflies. Do we need some push to get more transparency for consumers on things like ongoing costs, even with insurance, deductibles and copays are very high. Ongoing costs, the necessity of the recognition of periodic obsolescence, which comes as a shock to a lot of people, the lack of robustness of the external parts. So when a consumer buys into any one of the three manufacturers, they're in it for life, and they're not necessarily aware of what is going to be coming out of their pocket every year or every 5 years or whatever. So we know there's a lot of work that needs to be done with the insurance companies, but should consumers be made more aware upfront of what this CI process really entails down the line? Certainly parents of kids, but also, also for adults, senior adults on fixed incomes and so on.
Right. So that is probably a very hard question to answer, because I know some audiologists and the CI clinics are very good about covering that, and some may not be as good about covering that. So that's I can't speak for what the companies would say on this, but I do know that, I've been told by some people that yes, they got the full rundown, and so they felt well prepared. And there were others who like, as you said, were completely unaware. So I think that overall, a broader scope of the long-term care of it, because it is a medical device, is important. But I think it's also what's frustrating sometimes from the policy side is just how varied the insurance coverage is. I've had some people say, I've never had to pay for anything but maybe a copay here and there. And then other people with the same device are paying thousands of dollars for the follow-up care. So it's kind of hard to pinpoint, but I do believe there is some truth to the fact that a broader scope of what the follow-up truly is important.
Are there other questions that people would like to ask? Nicole, I wanted you to know that HLAA has a Veterans Across America group that meets monthly on virtually. I didn't know if that's the group you were referring to or not.
I do know that they have that. I've gotten a couple emails about that, and some of the people that I interviewed are members of that already. But these were veterans that some of them didn't know about HLAA, or came to us through their audiologists, or came to us because they found our website. So some of them are indeed members of that, and some of them are not. But those who are members have very high praise for it.
Great. I have a question. It seems to me that maybe some audiologists aren't interested in referring people for cochlear implants, either because they just want to try with a more powerful hearing aid, or they don't know the process. So many people complain that their hearing aids aren't working anymore. And I have to think it's not just they haven't gone back to the audiologist, but maybe they're beyond any hearing aid. Is there some reason why audiologists are not catching on to this and referring people more easily?
So that's definitely been kind of the question that is asked at every conference that we do or anything along those lines. We very often have people who speak at, the AAA audiology conference about, what is it like to refer to somebody. That's why Terry Zolan, who is a world-renowned CI audiologist, put out the 60/60 guidelines, which is very specific about when do you refer somebody to a CI specialist. We have worked with the International Hearing Society, whose members are hearing aid technicians that you might find at a Costco or the like, about when do you refer again for a CI. A lot of them truly aren't aware of them sometimes, that they even exist, the device. So it is a lot of education. It's something that we work on a lot, and we're constantly trying to think of new ways to do it. We have given presentations. Some of our audiologists and some of our surgeons have presented before the Family Practice Association. We have done webinars for them. We have done webinars with Audiology Online, which is a requirement for a lot of audiologists get their CMEs, which is their continuing education credits, to make sure they can maintain their licenses. It's just a lot of continually pushing the information out there. As to why an individual one might not do it, they might not be aware. They, might have some wrong information. Misinformation, as we know, is incredibly prevalent. So part of what we do is the constant drum beating of, if you have somebody who has a severe or profound loss and they are not doing well with their hearing aid, refer them on for further evaluation, because a CI might be a good option for them. That is our constant drumbeat. And sometimes sometimes I feel like we're getting through, and then other times we are not. So it is a message that we continue to beat. We continue to, we just published again some candidacy papers in some, incredibly well-regarded medical journals that everybody reads. So that's just another way to move forward with all of the scientific backing that you could possibly want behind it. So we agree. It is definitely a problem. We have found that to be a problem with the VA and other places as well. And we just keep pushing those buttons and knocking on the doors and hoping that it will start to be a little bit more ingrained.
Are there enough audiologists who can assess for CI eligibility?
Oh, wow. That's a really good question. And I really don't know the answer to that. I don't know the number specifically. I think that would be more of a question for somebody from AAA. But I know that we do work with them all across the country. We have, some of them work in CI clinics. Some of them are private audiologists. Some of them work in giant hospital systems. Some of them work at the VA. So I think we have managed to get our fingers into everywhere. But as for the general number, I don't know the answer to that. That's a really good question. And I'm going to have to go find that out, because now I want to know myself.
Okay.
Mm-hmm.
Yeah, here's let person in. Well, as members of Hearing Loss Association of America,
Mm-hmm.
we have a difficult time
Mm-hmm.
with just making hearing loss known to people. Just simple, what in relation to a CI would be something simple, like a pocket talker or a hearing aid, or some device to connect to your TV. So, I mean, or captions.
Mm,
I mean, I feel there's a lot of discrimination
mhm.
against people with hearing loss, that it's not recognized medically because of whatever Medicare did not recognize when it was established, and whatever conflict was going on between hearing aid manufacturers at the time Medicare was put into place, that they didn't want to put hearing aids in there. So I just think it's a tough situation advocating for anything with hearing loss. What do you feel is the biggest challenge?
In general, I think it's just a general lack of awareness. I think that, as you said, I think that a lot of people might assume if you have a hearing aid, everything is fine, and there are no issues. So I think that's a lot of it. I think people assume that if you have a CI, it's a cure for deafness, and it isn't necessarily, because you still, if you take it off, you do lose that access to sound. So that those are some of the big ones. I think another issue with advocacy is that the bandwidth for what politicians are likely to focus on is very hard. They have big things that they like to fight about. I think you all are also aware that at one point, Medicare coverage for hearing aids was included in part of the Medicare expansion bill that hasn't really necessarily gone anywhere. And it's been removed, it's been put back in, it's been removed, it's been put back in. I honestly am not quite sure where it stands and which version of the bill. And having lived in DC for 25 years, people sometimes forget that on the Hill that what they're discussing impacts real life human beings. And generally you have a very small window if you were in a small policy world to get anything done, because the big things overtake it. You can sometimes move things quicker in the states because they're smaller. Florida just passed coverage for hearing aid coverage. So there are a couple states that are kind of knocking away at that part of it. But often, it's making sure that you were able to get the right message out at the right time to the right people. And finding that narrow policy window can be complicated. But there are a lot of us in the hearing health world who are out there talking about it, talking about what impacts hearing loss, how, going to all the rock concerts when you're a kid might have long lasting impacts, how being in the Marine Corps for 20 years and being in another country as you're, standing next to tanks could result in hearing loss, as I've told my husband, even though he swears he's fine. It's just the constant thing. And it's one that I enjoy doing. There's a lot of great partners like at HLAA, Barbara Kelly, who's the CEO there, and others are just fantastic people, and it's great to work with them. And so we just continue on.
Yes.
Mm-hmm.
And I have any other questions? I have another one if nobody else does. Is there a country in the world that you think is a good model for CIs and treating hearing loss? Is there a country that does it better?
One can make the argument that those countries that have universal health care probably do it a little bit better because it's a little more streamlined. And you're not wondering if your insurance policy is going to cover batteries or a processor or, anything along those lines. Certainly there are hiccups with that process as well. because sometimes there's not as much flexibility. I don't believe in Canada they cover single-sided deafness. It's not a part of their policy. I don't know the answer to that question fully. I do know that, you could probably look at some of the countries that, the CI manufacturers are located in. They might do great jobs. I think Australia does a pretty good job. And that's only because a good friend of mine is a doctor down there, and she thinks their medical care is 1,000 times better than the United States. So I'm getting a little bit of a biased opinion from Australia. I do know, I recently did a lot of look into research for like early intervention services for children with hearing loss. And we really do seem to be very good at that. There are huge gaps that need to be addressed, of course. But when we are really the only country that I know of that has like a newborn hearing screening program that's catching people or, infants as soon as they're born before they even leave the hospital. That's really kind of a unique program. And then enrolling them in early intervention services right away is also very unique. And there are other countries that probably would love to have that kind of systematic process in place. So that I think we're actually doing really well there. As for the rest of it, I don't know. We do have, the ADA, which covers a lot of, those things, and whether it's completely effectual is always up for debate. But we do have laws that are in place to help. But implementation is always a hindrance and fun.
Okay, thank you so much. Are there any more questions? Is there anything? I don't see any more questions in the chat. So
I am going to send to everybody my email address. And so I am happy to answer any questions, or if anybody has any further requests for information, just send it along and I'll get back to you. And if I don't know the answer to that, I will find somebody who does. So.
Okay, so Nicole, we want to thank you so much for your
No problem.
Spending the time with us today with your presentation and just, educating us about what's going on in the world of cochlear implant advocacy, so that, we can help people also by being, talking about this presentation, referring them to it, and just making life with hearing loss a little better. So thank you so much. And we'll say goodbye to you. And then I have a few announcements for everybody.
Good night, everyone.
March 24th is our Hope Support Group. It's every fourth Thursday. And I always enjoy this group. It's not just for people with hearing loss. It's people affected by the hearing loss of other people also. That means everyone is welcome. Our group always has new successes and challenges that participants like. We've gotten to know each other better. And then we have a picnic planned Sunday, August 14th, at Shady Oaks Picnic Area in Santa Rosa, and you'll get more information about that. Does anybody have any other announcements they'd like to make? So I want to thank you for being here. Please join us at any and all of our events. Please sign up for our Walk for Hearing Team North Bay. Please support us, and please appear in person. We'll go over there together to Alameda. That would be so great. And you can stay on if you'd like to socialize. So goodbye to those who are leaving, and hello to those staying.
Thank you for this, Sarah. This is a good session.
You're very welcome, Neil. So nice to see you again. Are you going to take another cruise?
Yeah, actually, yes.
You better tell us which ship you're going to be on.
We actually just did sign up for one for late August. So we'll see how that goes to Alaska.
Alaska. Okay, so I'm going to wish you better luck than last time. Oh boy.
It's a big step.
Yes, yes, I can imagine that. So why don't we, okay, so we can stop the recording here.